Say CBT already.
No, CBT already. Already.
No.
Son of duty exam back home already either.
No.
I was never this nervous for an exam.
Hi guys, welcome back to another video, and in this week's video we're going to be talking about some of the stations, but I put a little twist to it by introducing some international nurses from Jamaica all over, and today we have a Jamaican nurse here. All right, if you're new to this channel, my name is Nurse Mary, and my channel is here to share my journey with you along with educating you guys about nursing all over the world. And currently I am practicing nursing in not Jamaica, sorry, in the UK. So please click that subscribe button if you like this video. If you're a nurse watching this and you are currently in the UK and you're interested to be a part of this marathon, you can email me or comment and I'll definitely reach out. So today I have Shannique, Mrs. Shannique Graham Tucker. All right. And she is an international nurse who is also a registered nurse in Jamaica, but she's practicing now in the United Kingdom. All right. She's going to walk us through her experience with the OSCE exams. She's going to talk about one particular station, which is the catheter removal. And she's going to give us some encouragement. So thank you so much, Shannique, for really being here with us. I know it's your one day off, and trust me, we're tired.
Yeah.
So I'll leave this up to you now.
Okay, so I am Nurse Shannique Graham Tucker, as Tasha said.
Yes.
So I've been a nurse for 3 years now. So for the OSCE, the examiners really and truly, they want you to pass. That's just it. Plain and straight. They want you to pass. They know the hard work that you put in or you will be putting in if, you'll be coming over here. They know the stressors. They know the nerves. My examiner she was a sweetheart. She said, I know you're nervous, but don't worry, you will do well. As long as you had studied and you had practiced and you put in the work, you'll be fine.
Okay.
So, for my station, so I got a patient who was, patient was a pre-surgery patient, right? So, I had a pre-assessment for my patient. However, for this specific, scenario, removal of urinary catheter, I don't exactly remember what the scenario was, but basically in a gist, it was saying that my patient had already gone to surgery and came back for post-assessments, and I was supposed to remove the patient's urinary catheter.
Okay,
right? It was a female.
Quick
right?
question, Shannique. Quick question. Do you think you get your scenario based on the type of nursing that you're going to practice in the UK? Reason being, I got pneumonia in the community, and I'm in the community, and you're telling me about pre-op, and you're in the operating theater.
Wow.
Yeah. It could be.
It actually makes sense.
Yeah, it could be. Anyhow.
It could be.
Yeah. That's interesting. Continue. We'll learn more because we have other nurses going to express themselves. So yeah.
Wow.
Yeah.
I didn't think of it, but in truth and in fact, possibly.
Yeah.
Possibly. So, as she says, I work in operating theater.
Yeah.
Right. So, and I didn't make the connection. But anyways, so for my partner with the removal of urinary catheter, so my assessor told me that okay, you have already entered the scene, you've already checked for scene safety, and now you're going to introduce yourself to the patient and proceed. She says, when you are ready, let me know. If you're not ready, then we won't start. We have all the time. I'm a dead here, I'm a dead here, I'm a dead here, I'm a take deep breaths. I said, deep breath. She said, you want water? And I said yes, and I went and I sipped on my water and I gathered myself. And I said, okay, so if I've already come into the room and I've already checked my scene for scene safety, and it's introduction time, then boom, bam, because we're timed, right? Remember that we're timed. So I said, okay, let's go to this. You know, I looked up on the time and she says, whenever you're ready, I'll start the time. And she says,
and how much time was this?
Is it 8 minutes?
Yeah, I think so, yeah.
Removal of catheter is 8 minutes.
Because the pre-checks are done in the scenario, so it would be like 8 minutes.
Yes.
Yeah.
So 8 minutes. So I went in and I said, I don't remember exactly what I said, but basically I introduced myself. I'm Nurse Shannique. I'll be your nurse for today. Could you remind me of your name? I got the patient's name. And then, you know, I was checking along with the document that I had, the patient's name, the patient's date of birth. And being that I wasn't actually in the hospital. I checked for the patient's NHS number, right? But the patient wouldn't know the NHS number, but I still had to say it, right? For safety reasons. And I asked for the patient's address. And everything coincided. I asked if the patient has any allergies. Patient said no, right? Good. And then I could verify that with the document that I had.
Right.
Then I said, okay, I told the patient what I was here to do. So I was instructed by your doctor to remove your catheter. And I'm your urinary catheter, and I'm here to do that. And I explained some of the post-catheter symptoms that you may or may not have, right? So I explained that you may feel some discomfort while I'm removing the catheter, as well as after removing the catheter. You may feel, you may have some frequency, like urgency for urine, may or may not, right? And I said, then I went on to say that if you, like, but you still have to get them consent, because not because the doctor said yes, that doesn't mean that they want it, right? And it's better to let them know some of the ill effects or the drawbacks to doing certain things and then gaining their consent. My patient said yes, she's okay with that. So I said, okay, give me a second, I'm going to go and gather my necessary equipment, because remember, you know, with time bound and so I can't move fast. I went and I gathered my equipment. So my equipment were my apron. I checked my apron. I took 2 pairs of gloves, non-sterile gloves. I took up gauze. I took up sterile water. What else did I take up?
A syringe.
Yes, my syringe, of course. I took up my 10 ml syringe, and that was very important. So your 10 ml syringe, and when you're taking up the syringe, you know, you have to be specific, because in the drawer, the skills drawer, there are multiple different sizes of syringe. So you have to check your document, check your scenario to say, okay, there was 10 mils used to inflate the balloon, right? So I looked up and I said, assessor, based on my scenario, my patient had 10 mils used to inflate the balloon. Previously, I'm going to use a 10 mil syringe to deflate now.
Okay.
Lord of His mercy, I'm starting getting nervous now because it's time to go back to the patient. So I quickly washed my hand, I put on my apron, I went back to my patient, and I said, I'm back again to remove your catheter. Is it okay for me to proceed? Person said yes. Stop. Did my little sanitizing of my hand, I put on my unsterile gloves, and I let them know at that point that after removing the catheter, I will be doing perineal care, if that's okay with them. Because that's a part of it. That's a part of the criteria. You have to, even after removing the catheter, you still have to ensure that you do perineal care, right? So the patient said yes. So I said, okay, no problem. So I said, okay, I'm gonna lift up your dress now, because she had on a little dress. And is that okay with you? I got the permission from my patient. She says fine. So I folded her dress, and she had a little sheet. So I still, you know, trying to provide some kind of privacy for her. So I put it up to where what I needed to see, basically, right? And I said, I'm going to check the urine bag to see if there's any urine in the bag.
Yeah.
There was no urine in the bag, thank God. I said to the assessor, if there was any urine in the bag, then I would have to empty it first in a container and discard of that in the sluice room. Right?
Mm-hmm.
You still have to make the assessor know what you know what you're doing.
Verbalize.
Right? You have an idea of what's going on.
Right.
Then I had taken cotton swab to clean the ports.
Yeah.
Right? So then I cleaned the ports. I said I'm going to clean the port for 30 seconds. Mm-hmm. By the time me reach at 10, my assistant said, proceed. Yep. I say yes. Mm-hmm. Now for 30 seconds. So I said I'm going to allow it to dry for another 30 seconds. By the time, because I was verbally counting out loud so she could hear. Yeah. So I was like 1, 2, 3. By the time I reached 5, she said, proceed. Yeah. Mama. Mm-hmm. So it dry, right? Mm-hmm. So now, I attached the syringe to the port and you actually start pulling back now. Yeah. So I pulled back, and then after pulling it back, I looked up and I showed the assessor. I said, assessor, can you verify that this is 10 mils of fluid in the syringe? And she says, yes, you can verify. Right. I put down the syringe and I said, okay, I don't remember what was the patient name, but for example, the patient name Sarah. Yeah. Sarah, now I'm going to be removing the catheter. Mm-hmm. I'm going to do this slowly, but in a continuous traction to prevent any kinds of pain or irritation to you. Right. Okay, and then we start do it. Make the assistant me I do my thing. And while talking to her, I said, "Are you okay?" While doing it, I said, "Are you okay?" She said, "Yes, she's okay." The patient is saying that, and I encourage her to take deep breaths. So while removing it, I encourage her to take deep breaths. Right. All right, remove it now, and I put the urinary catheter in the appropriate clinical waste bin. You have to tell them, so you got to do it, and you actually do your thing, right? Then I removed the glove that I was using, sanitize my hand, put on a new pair of gloves, and I said, okay, now I'm going to clean the genital area. Is this okay? Is it still okay with you? She said, yes. I open the gauze pack, I pour sterile water on it, and I said, I'm going to clean the area. I'm going to clean from top to bottom. And then I do my thing, clean from top to bottom. By the time I look up, I think I had 1 minute left. Yeah. So when I realized that, so while cleaning, I was like, okay, so I start doing some education now. Yeah. So you have to think quick. You can't just be robotic about what you're doing in this exam. Yeah. You right? So I said, okay, I'm going to encourage you to drink 2 to 2.5 liters of water. I'm going to encourage that when the first time you pass urine, let us know. Yeah. Right? So being that is not in the hospital, I had to let her know that you can contact me by my work number. I will leave this with you, or you can contact your GP. You already have this number. Right. All right, because we need it for documentation purposes. Yes. Jesus.
Let them know. Yes.
Then put back down my patient dress, right? Provide her back with her privacy, and then we start to take out my things them quick, time to take out my PPEs them quick, Yeah. And I think by the time I looked up, it was 10 seconds. So I said, I'm going to discard off my used equipment in a proper clinical waste bin. Yeah. I'm going to do my final documentation according to WHO guidelines, and I made it done. Me just done. Look up, 10 seconds done. But it wasn't a hard station. It's just a matter of practicing the right thing. Yeah. And practicing over and over, doing it over and over. Because our way in doing it back home, it's a little bit, it's a tweaky difference, but it's the same thing. Right. The principles still apply. Yeah. It still applies. So that was it for removal of the urinary catheter.
Okay, and what would you say is the key points for this station not to leave out? What's the red flags? Definitely you have to do these things.
All right, key points. Letting your patient know of the possible post-catheter symptoms that they may face. Right. That is very important. Ensuring that your different moments of hand hygiene, you have to maintain those.
Right.
It is very important. Not just yanking out the catheter, letting them know that you're going to do it in a gentle but continuous traction.
Right.
Right? Letting the patient know that, or encouraging the patient to drink 2 to 2.5 liters of fluid per day.
Right.
Right? Also, very, very, very important, I think, cleaning the area.
Yeah.
Cleaning the genital area and making the person comfortable.
Yeah.
Right? Sixth thing on my list, you have to read your documentation to know what syringe you need to take. Right? In order to deflate the balloon.
Yeah.
Another thing that I think is very important is telling your patient that they need to let you know when they have passed urine.
Yeah.
That is very important because something may just be wrong with the patient and the patient may end up needing a scan or need another catheter again.
Yeah.
We don't know.
True.
Oh, something that I missed. When I had taken out the urinary catheter at the tip, you should look at the tip to see if it's broken or if you're seeing any blood or anything that just doesn't sit right with you.
Yeah.
Right? Because if that's the case, then you will have to clip the tip of the urinary catheter, put and send it off to microbiology for testing.
Yeah.
Very
so
important.
That's a key point, guys. Assessing. It boils down to assessing.
Yes,
okay.
You're assessing. So you're not just doing this for doing this sake. You have to do it like it's a real life situation. You know? Like, this is a concern because if I take out a catheter now at work and I see blood on it, there's trauma.
Yeah.
Or when I look at it and I see green substances, that's a red flag, you know?
That's very good. So next question, what was the most difficult part for preparing for this exam? Overall, for the OSCE exam, what's the hardest part being an international nurse for you?
Not knowing what to expect.
Yeah. And what really helped you to prepare for this exam? What materials really was that one thing that helped you?
You see, if me did have you all along, if you did depend this thing.
Girl.
What? I had to go to other YouTubers. Honestly, I went to other YouTubers that did their OSCE and passed their OSCE.
Yeah.
To be honest. Apart from the materials that are on the websites, because they flood you with different materials. But YouTube was my best friend. I lived on YouTube. I watched and watched, and while I watch me, I try to do it at the same time to try and see if I've grasped what they have said to me. And also practicing on my own. Just practicing on my own, practicing non-stop.
Yeah. So practicing with groups or practicing by yourself, which one was the best for you?
For me personally, not per se group, but I had a friend, or I do have a friend that she came up with me. So we used to like gather and sit and practice together, seeing each other doing the same thing and said, okay, we need to tweak this or alter this, or that was it for me. So I had that one friend.
Okay. So what's your advice for the upcoming persons who have OSCE, Jamaicans, and even international persons? Like, what's your advice for them?
Okay. My encouragement to you. First of all, you should do your own research.
Yes.
Right? Research is very important. You need to know what you get coming into.
Yeah.
Right? So, other persons who have done it before, like yourself, Tasha. Go and watch Tasha's previous video.
Right. Subscribe.
That gave you on the insights of moving from Jamaica to here. Right? Even though we know that everybody have their own little tweaking things, you know.
Yeah.
But at least you see another person who has went through it. They can give you an insight of what may or may not happen for you.
Right.
So research, I think, is very, very important. You have to have a mindset that, okay, when I come here, if it's game time, it's game time. I got to do what I got to do.
Right.
Right? You have to leave certain mindset or mentality back home.
Yep. Yep.
Because certain things here are very strict. They're very strict with certain things. They micromanage certain things. Right? When you come here and everybody are your friend.
Well, straight across the board. Straight across the board. Straight across the board.
Not everybody's your friend. You come here for like me, you come here to do some game changing kind of things in your life.
Right.
So if that's what you're coming here to do, then that's what you need to come and do. Stay focused.
Yes.
OSCE, I think honestly is the hardest part of the journey. The transition from nursing back home. OSCE brought my anxiety levels above it.
Yeah.
But I think when you're determined, so you have to come with a different level of drive for determined. If you're determined that you're going to make it, you will make it. It will not be easy.
Yeah.
But if you have that level of determination, family support is very important.
Yeah.
Friend support, if you have a good friend, Tasha can be a friend, because I see Tasha go through this already.
Yeah.
She can be a little friend to guide you through the process. You will need support because it will not be easy.
Yeah.
Nowhere is the same. No two places the same to me. So Jamaica is different as against UK is different. The way in which things operate in Jamaica is not the same that it operates here in the UK.
Yeah.
You have to come with an open mindset. That's another thing.
Yeah.
Come with an open mindset
so
to know that.
Could you give them some examples?
Not because
of things.
Come again?
Could you give them some examples of things that happen back home and it's different where you at, because where you're at is different from where I'm at. So it could be different things, you know?
So, well, it should be the same, what I want to say now. So, documentation is a must.
Yeah.
Document, like, say, you go to court tomorrow. And nobody feel like, say, if people don't want to drop a charge for you, they won't drop a charge for you. So, you have to come and you document. Although I do typing, it's the same documentation.
Yeah.
Right?
Documentation where you're at, is it a full, thorough A to E assessment, or is it like an overview at the end of the day? Like, what's documentation for, you know? Because I realize every trust is different.
Yeah, but for me, I don't do A to E assessments and stuff like that because I'm in theater.
Okay.
So,
yeah.
For me, it's basically what happens in surgery. What are some of the things that we used in surgery?
If it was eventful.
If the patient had any, you know, mishaps or surgeon had any mishap or any nurses had any so stuff it's like not that. Like it's not specific to the patient.
Okay.
Per se. So I don't know if it's the same back home with theater.
It's slightly different.
Slightly different.
Yeah.
Some of my friends that are on the ward currently, they say they have to do a full A to E assessment, and they have a template that they have to follow. They can't deviate from it.
Yeah.
So,
well, everywhere is different.
Everywhere different.
True.
So yeah, and they tell me, like, for example, the fact that we have a stool chart, we have a chart for everything.
Yeah. Yeah.
Over here.
Yeah.
Stool chart, urine chart.
Yeah. My defense, I learned about the Bristol stool chart when I came to the United Kingdom. Okay? I did not learn that at UTech. I did not, honestly. But it's very straightforward. It's not hard.
No, it shouldn't be hard.
It shouldn't be hard. If you get the joke, it shouldn't be hard because that's constipation. Okay.
I got you. It should have been.
Okay.
Yes, girl.
So, thank you so much, Shannique, for sharing your views on this station and as well as giving us some encouragement. I mean, for me personally, when I was doing this OSCE exams, I was on YouTube searching to find somebody from, you know, the Caribbean or somebody just talking about their experience and not just seeing persons doing the station itself, washing palm to palm, back of hand, back of. I needed somebody to give me an insight. So this is why I wanted to, you know, put nurses out there so they can share their views on this exam, because trust me, it's a life changer. And if you know, you know. All right. So if you're a nurse watching this and you know, please to reach out so you can share your views. I mean, we all can learn, and if there's someone in the future who might be seeing this, it can help them to navigate better in training for these OSCE exams. And yeah, so I really appreciate you coming on here and just taking time out of your lovely day off, your one little day off.
Fine.
We really appreciate it. And yeah, so I think we might be wrapping up this video now. And yeah, guys, subscribe, like up the video, share up the video. Until then, bye.